clavicle. I hope you are all having a great weekend. Well, you probably know that the anatomy is quite can be quite unique. There is no absolute anatomy in terms of a measure, or you might find some variations. So especially when you go and draw the human body, you don't need to be worried about symmetry. Of course, you want at least to keep that anatomical structure similar to what you are supposed to find in the body. But I would say that is not something that most of the time is always the same thing. Definitely you will not find, especially when you talk about paired bones, you will not find completely symmetrical bones. So here we have this superior surface of the clavicle, and one of the features that you will notice is that the superior surface is quite smooth. It's not fully smooth, of course, but compared with the inferior surface is rough. I'm gonna draw I'm gonna highlight a few areas here. Thank you for the likes. I don't know who gave the like, but thanks so much. Okay, I'm gonna draw these impressions. As you can see, they are rough. This one is basically for the costoclavicular ligament. We have this one for the conoid ligament. This one for the trapezoid is actually the trapezoid line, and this one is the one of the ends of the clavicle. We have two ends. Hello, Michelle. How are you doing? We have the acromial end, or lateral end, or acromial facet, and we have the medial end, or medial facet, or even the external facet. How are you doing, Michelle? Where are you from? Thank you for the support. On the superior surface, you will notice that more towards the middle aspect, we are going to find a rough area, not quite smooth as the center. And the reason why we will not find smooth here is because in this area in particular, we don't have any specific muscle attachment. Actually, yeah, we don't have any specific area for muscle attachment. Much more on the lateral, more towards the lateral end and towards the middle end of the clavicle. So here we have the subclavian groove, and the subclavian groove can vary in length. Yeah. I will not work too much on the minimal details. I want to show you much more how I do the drawings for my studies, my personal studies. I basically cannot teach in this way in the uni because they have their specific way to conduct the classes, and it's quite standard, and we just follow what they do. They say actually. Maybe in the future, I personally believe that dual coding is one of the best ways to learn anatomy, especially because you repeat verbally, you visualize the structure, you also um, uh, remind yourself that image of the structure. So it's pretty much like a use your visual memory, and then you reproduce with the pen or the pencil or the or whatever, to especially to improve your muscle memory. So yeah. Hi Josh, how are you doing, Josh? So far so good. So as I mentioned, this is the superior surface. This is the anterior border. Let me just put A here. This is the posterior border. When you turn the clavicle upside down, you see that this one is the inferior surface. I'm gonna write IS here. I know that might not be that big for you if you are watching from the screen of your phone, but here we have the posterior border and the anterior border. So we have the anterior posterior border on the superior surface, anterior posterior border on viewed from the inferior surface. Here we have the acromial facet. I personally like to call acromial end, but I'm gonna just put as acromial facet. Acromial facet. I will not change. I will keep the same because I don't want to create any miss. No, actually, if you think, yeah, this is the acromial end. If you think in terms of area, probably this one. Acromial end, external end, external end. And here we have this external facet. Okay? I shouldn't be using these abbreviations to teach, but as I talk, you probably are linking these structures with what you already know about the clavicle. So here we have the shaft of the clavicle. How I'm gonna write this? I don't want to take too much of this space. I'm gonna write probably here. Shaft. Was not definitely not the best way to label that structure, but again, it's not that proper illustration for an anatomical book. It's just more like to present a few areas related to the clavicle that might be relevant for your studies. This one in specific, okay, so this area here of the superior surface is related to the skin. I hope that makes sense for you. Okay, so what else we have here? We have this groove here, this area right here that is the subclavian groove. Subclavian groove. Okay, if you can tap just to give a like, it will be really helpful just to push this live and share with more people. Maybe, I don't know. Let me know, guys. Are you studying anatomy as well? Why you are here now? Okay, some people just left. That's fine. So this area here of the anterior surface, superior surface, I mean, as you can see, as I mentioned before, is flat, especially in its lateral third, and convex from anterior to posterior. Okay, it's convex from anterior to posterior, and here convex anterior to posterior. Now it's basically related to the skin and the cutaneous muscle called platysma. Okay. um, what else? Thank you, guys. Thank you for being here with me. Here we have the impression for costoclavicular ligament. This is the impression. I'm gonna write this one. Impression for costoclavicular ligament. Okay, so what else? We have here the conoid tubercle. And this one is the trapezoid line. Conoid process, tubercle, sorry, trapezoid line, subclavian groove, the posterior aspect, anterior aspect, but viewed from the inferiorly. Here we have the impression for the costoclavicular ligament. This area here is the medial or external facet. External because it's connected with one of the bones of the sternum, which is called manubrium, and also part of the first costal cartilage. And here we have the lateral end, medial or external end, lateral or acromial end. This part here is the acromion acromion facet. Yeah, I'm right actually. And again, acromion end or lateral end. Again, the anterior aspect is from anterior to posterior convex. And one of the things that you notice is that the clavicle has this capital letter S that is italic. It's pretty much like a sign like this, like a S in italic. Yeah, this is one of the features of this that is considered one of the long bones of the body. Okay, remember, the clavicle is, despite its size, it is a long bone. And we have this joint here related to the manubrium, né? Yeah, but it's actually the sternum that's called the sternoclavicular joint. And we have the other extremity, which is the lateral one, uh, where the lateral facet or acromial facet will articulate with the acromion, called the acromioclavicular joint. Okay, this one is a saddle joint. It's a saddle joint because it has this concave convex interaction between the two extremities, one of the manubrium, the other one of the clavicle, and the other one is a plane or glide, or also you can also call it gliding joint. Now, where else? There is something about this joint here, the one related with the sternum, that's important to mention, because sometimes you will find books or even papers discussing the real kind of joint that is this one, because this one has features that resembles both saddle and plane joints. Why? Because the shape of the external end, or much more the external facet, will have different conformation. You can find a very thick and I would say square, maybe triangle, maybe ellipse shape. Okay, and this, depending of the shape, it will be different, the joint. Yeah, it's basically this, and but functionally it works much more like a saddle joint. What some of the movements related with the sternoclavicular joint are elevation, depression, protraction, considering that this area here is anterior and my sketchbook is posterior. So anterior protraction, retraction, and also limited rotation. And this rotation will happen only when the bone only when the arm is raised over the head. Okay. And also there is another interesting feature here is that I would like to mention, and you probably know, is that this one is the only bone that will be directly connected with the thorax or the axial skeleton. So if you see in terms of bones of the upper limb, this is the only one, the only bone of the upper limb that will be attached to the thorax, and it's also the only one that will be positioned horizontally. Hi Samantha, how are you doing? How are you doing, guys? Thank you so much for taking your time. Sunday, 15 past 7, to stay here with me, learning a bit of the anatomy of the clavicle bone. Yeah, I don't know why you are here now, but yeah, welcome. Thank you. I'm just here because I love study. I love studying. Okay. I mentioned before, just to help you to consolidate this information, that the articular surface is reciprocally concave and convex. So because this is a saddle joint. Now the acromioclavicular joint, which is the other uh, as extremity of this bone, is located between the lateral end of the clavicle and the acromion of the scapula. When I talk about the acromion, you will have a better idea of its function, how it works actually. Now, this is a kind of gliding joint. In terms of movement, is very limited, and you will notice that, like any other uh, plane joint, it will allow slightly gliding and rotational movements, especially during full shoulder elevation. Um, yeah, and it's this joint that is specific is stabilized by the acromioclavicular and the coracoclavicular ligaments. Yeah, I hope that this information makes sense for you. I know that there are a lot of things here. I've been mentioning a lot of yeah, that's literally a lot of information. I know when you talk about degrees of movement, that's something that is it's I consider that it's really important to know, because once you have a better idea of how much range of motion you have in a joint, you will also have a better understanding of things that are working properly and are not. Uh, I don't know why, because it can be because of the some problems with the affecting the nerves that supply the muscles that move this bone, or it can be any other thing related with this area or areas that are distant but also directly connected with this structure too. Thank you, Ozzy. How are you doing? Guys, where are you from? Would like to mention something? No worries, no worries. You don't need to. If you drop a message, you don't need to retract your message. It's fine for me. I do very well. But yes, welcome, Ozzy. You are very welcome. Now, I mentioned before that the movements of the sternoclavicular joint are basically elevation, which moves up approximately 40 to 50 degrees. We have depression to 5 to 10 degrees. And remember, no worries, Ozzy. I hope you are doing well. So imagine that the clavicle is here positioned horizontally. Here is the chest, okay? Here is the chest, and the clavicle is here. Now, an elevation of the clavicle is approximately 40 to 50 degrees. Let's say approximately here. Depression, we come back to the neutral position, is 5 to 10 degrees to this way. And then we have protraction. Now you need to imagine that during the protraction, the clavicle moves forward towards 15 to 30 degrees and backwards in retraction to more 15 to 30 degrees, which is not that much. Looks like, wow, 15 to 30 degrees. If you consider that here is 90 degrees, we have here an acute angle, probably 30 degrees will be around this 15 to 30 degrees, which is not that much if you see, no? The other thing is about rotation. When we elevate the arm in full for overhead motion, we have rotation, axial rotation of the clavicle, which is approximately 40 to 50 degrees. So these are mainly the degrees of movement that we are going to find at this extremity, okay? The medial one, the medial end. Now, when you move to the lateral end, we are going to have only gliding or some rotation as well. So in this area, no worries, no worries. I don't know who is sending the laughing, but welcome. Okay. Uh, so this area here of the acromioclavicular joint, we are going to find gliding or rotation, which is minimal to 5 to 10 degrees, and is uh, not usually measured in isolation. So we need to measure with other structures. So yeah, these are basically the I would say the map of functionality, really, of the functional anatomy of the clavicle. We have a few more things to mention. Yeah. Um, Again, I mentioned about the anterior posterior, the shape that resembles a S, a italic capital S. We have the inner curve, okay, where the concaved face posteriorly, okay, and we have the outer curve where the concavity faces anteriorly. And the superior aspect here, super inferior, we can say, it's more flat. No, actually not. Well, if I tell you my background, you will laugh. But okay, because you asked, I'm gonna say I think that you are the only one here. I have a background in mechatronics. Yeah, I did back in Brazil a technical course of 3,000, more than 3,000 hours of in industrial automation and mechatronics. Then, after episode of depression, I decided to change career, and then I did sports and science. Hi, cute. How you doing? I did sports and science, and then finished my after finishing my sports and science training, I did physiotherapy training. So this is basically anatomy of the clavicle bone, anatomy and functionality of the clavicle bone. I did my, as I mentioned, my bachelor in sports and science and physiotherapy, and then it was 2 years and a half now. I recently finished here in the UK my master's degree in clinical anatomy. Anatomy was always my favorite subject during my sports and science degree, together with biomechanics. So I think that in some way I'm not good at maths. I will not lie. I will not say here, oh, I'm great with maths. No, I'm not. I definitely not that good with maths, but I know a few things. Um, and I think that this previous experience learning bio engineer also helped me to like more the topic biomechanics. Oh yeah, and the other thing is, before all of this, I always wanted to be a comic artist, and I used to draw a lot in Brazil, but because life changed, I've had to take different directions. So because these qualifications. So and then I stopped drawing, and when I moved to the UK 10 years ago, I started drawing again with moments of ups and downs. Sometimes drawing more, sometimes not even drawing for 9 months, and then now I've been also basically working as a medical illustrator in the anatomy department in the university where I work. I will not say the name of the university now, guys, because yeah, but I work in the university, so in the medical department, actually for the medical course with in the anatomy department. And this is part of one of the things that I do in the department, medical illustration, either 2D, not like this. I do sometimes the sketches on my sketchbook or on Krita, and then I transfer the image to another software to vectorize the image, and then present the image and attach the same image to specific workbooks for the medical students. So it's basically what I've been doing. I'm a big fan of the open source softwares, but I've been learning how to use the uh, Adobe Illustrator and Adobe Photoshop, which is really relevant for this field. So yeah, this is pretty much what I do. Clinical anatomy, more medical related, and also functional anatomy are the topics that I'm really into it. I also, believe or not, I also teach some drawing skills when people ask. Well, back to the topic, I was mentioned that we have this concavity that faces anteriorly, and I also mentioned that the bone is flattened, super inferior, and also has two surface, superior, inferior, two borders, anterior, posterior, and two ends, lateral and middle, if that makes sense. So, despite being a small, yeah, it is considered a long bone, but it is small compared with the other long bones. There is one that is even more longer, actually, even smaller than this, but there are actually a few others, but I'm gonna mention about these bones in another video. If you are interested, of course. Now, the superior surface is almost flat, especially in its lateral third, okay? In its lateral third, and convex anterior from anterior to here, from anterior to posterior. Okay. Uh, what else? Yeah, and I'm talking about convex from anterior to posterior much more on the middle 2/3. And this part here is related with the cutaneous muscle called platysma, which is also separated by, because here we only have above this we have the skin, okay, and these sensory branches are the sensory branches actually from the superior cervical plexus, which is also called the supraclavicular nerve. Okay, so the other thing here that is important to remember, we have paired bones, we have the right clavicle and the left clavicle, and they are both asymmetrical. The superior surface is smooth and uniform in its middle portion because we don't have any muscle attachment to this area here. This area, we remember, we don't have any muscle attachment. Usually you are going to find rough areas at its medial and the lateral ends, and these are especially for the insertion of the specific muscles. Now, the inferior surface, which is this one, is convex but more irregular in texture. If you have the opportunity to grab a clavicle bone, I don't have one of the plastic models that I have. It is in another house, but when I bring to this one, you will have a better idea. But we have another. The inferior surface is quite rough, and is also convex but more irregular, and especially moving from medial to lateral. And here from medial to lateral, we are going to find adjacent to the medial end a rough area for the attachment of the costoclavicular ligament. This one. This is the rough area for the costoclavicular ligament. Slightly more laterally, we are going to find the longitudinal groove, yeah, which can varies in length, and it serves as a seat for the insertion of the subclavius muscle. And more laterally, we are going to find another rough surface orientated more obliquely from medial to lateral, as you can see here, okay, and from posterior to anterior, okay, posterior to anterior, sorry, comparing because we are seeing from the inferior view, posterior to inferior, and this one we work for the attachment of two coroclavicular ligaments. We have the conoid ligament and we have the trapezoid ligament, okay, which will attach to the trapezoid line and the conoid tubercle. Um, um, yeah, basically this. Close to the midpoint, we are going to find the area of the nutrient foramen of the bone, which typically opens more obliquely towards the lateral end, if that makes sense. I know it might be very complex. I'm going very deep here, guys. Even for medical students, we don't go that deep. Stop the biap, the biap. What do you mean? Sorry, I didn't get. It was too much. Is it? I didn't get. Sorry. Stop the buy up. Well, I think that I'm gonna finish here, and maybe tomorrow or well, let's see. Tomorrow I have classes to teach. I have the whole full day working, probably dissecting a few specimens. But if I get home, this is something that I do just eventually, guys. I'm not doing. I've been not doing this regularly, but it because I got 1,000 followers 2 days ago. Yes. So thank you so much for the support. I think that is my responsibility to come here and just share a bit, some bits with you, and to show my appreciation for your support. And yes, 36 minutes. I think that was more than enough. It's a lot of information. I still gonna talk. I will gonna talk about the borders, the anterior and the posterior, and the ends of the clavicle. I I believe, guys, if I go in depth to talk about each bone, I would take much more than 1 hour. Yeah, and especially because I've decided to do more in a informal way. Yeah, I'm just here like chatting. I want to make this time a little bit easy for you as well, because I know how much anatomy can be a struggle. And when you feel comfortable with someone, like having a chat, you will the way that you absorb the knowledge will be much more digestible. Personally, I think. I don't know. What do you think? Okay, so once again, thank you so much for your support. This is the first part of the video of the clavicle, and if you want to know more about the second part, just follow me, and just activate the ring bell here that will send notifications when I'm live or when I upload new videos. Take care, stay healthy, keep studying, and see you next time.